Hi, I'm Dr. Salmon, and today we want to talk about chiropractic in a nutshell. Many a new patient will come into my office and they'll have this experience of confusion. The reason is that they came into the office maybe with the idea that the mass consciousness has about chiropractic, and that is that, yeah, I'm not sure what they do, but they're kind of good for neck pain and back pain, and or maybe the more progressive among them might know that sometimes they help with headaches. So that's the mass idea. But the person sitting there in my waiting room, and they see someone walk in with a neck collar on, and they're sitting next to a hyperactive 6-year-old, and then they see these people that look shiny and happy and look like there's nothing wrong with them whatsoever, or they may see some really stressed out looking businessman, or maybe some woman trails in with 3 kids. They seem to have nothing wrong with them, and they go into the room and they come back out, and you wonder why they were even there. The question is, why is this occurring? People are used to the medical model, and the medical model is that we're going to replace the functions or the parts of your body in a mechanistic way. We have an orthopedist, we have a pediatrician, we have gerontologist, we have a radiologist, we have heart doctors and lung doctors and gastroenterologists, and the body's been sectioned off. We even have podiatrists, so we even go head to foot, and that's a mechanistic view, and that has not always been the view in healing. There's something called vitalism. In mechanism, we have the body is equal to the sum of its parts. Where in vitalism, we have the body is greater than the sum of its parts. What do I mean by that? Well, there's this something extra that makes us individuals, and that internal force is the driving force for our vitality and our health. Some may refer to it as prana, others refer to it as chi. In homeopathy, a lot of times it's called the vital energy, and in chiropractic we call it innate intelligence. It's while we're all very close in chemical structure, we're very different energetically. Now, the reason this happens is that, well, let's go back a little bit. First of all, the nervous system is the master system of the body. It contains the brain, the spinal cord, and the peripheral nerves, the ones that go out to all parts of your body. So the impulses that travel over this nervous system go from the brain down the spinal cord out to the nerves, and then it will go back from and report from the periphery back into the spinal cord and into the brain. Now, we live our lives through our nervous system. We perceive the world, we perceive what's within us, and we perceive that which is outside of us through our nervous system. If our nervous system is working good without any interference, we have this happy, healthy life. If we have interference in this nervous system, we then start to have either pain or dysfunction, or a general at ease, not an at ease, but a dis-ease type of feeling. What chiropractors do is look for this interference in the nervous system, all right, and it can occur in any of the sections. It can occur in the brain, the spinal cord, or in the periphery. Most times we find it in the spine and the periphery. When a chiropractor deals with interference, we like to call it a subluxation, which means that it's less than a luxation. A luxation is a breakage of a structure so that it causes real serious interference. A luxation would be a broken neck, say. But a subluxation is a lot less than that. But what it does is it causes this interference in the nervous system so that the nerve impulses aren't flowing freely. Now, the problem is that not all subluxations are self-evident. What do I mean by that? It's very easy to have nerve impingement and not even know that. Say that you walk into a room that has a smell, right? And you notice the smell, but you're in the room for a while and you accommodate to it. You know, your nervous system, you know, starts to perceive it, and then it shuts it down and takes in other information. The same thing is true in with subluxations. The body can almost get used to it, even though it's dysfunctioning, and that's that is a problem, because you know, subluxation or this interference really is impinging on your life. Now, when we're talking about the causes of subluxation or nerve interference, it's easy to get the concept of direct trauma, where you know you fell down the stairs and now you're misaligned and you're impinging off on a nerve. That's an easy concept to get. The one where the chemical stress or the emotional stress, it's harder for people to understand, and that works more like your kitchen. And how do I draw this analogy? Let's say that you're in your kitchen, you're running a refrigerator, and you're running a stove, and you know, mixers and all those types of things, and then you know you're in there working, and all of a sudden maybe somebody decides they want to plug an iron in the same room, and it pops the circuit breaker. Okay, what happens? The system became overloaded. The same thing is true with your nervous system. You can be under a lot of physical stress, eating the wrong foods, and the spine will subluxate as a reflex to dissipate the overload, so that there's no damage done to the system, no severe damage done to the system. We would rather be in a state of dysfunction than in damage, and so that's how that occurs. That's a harder thing for people to understand. Now, most people coming to see me have a combination of the three: the physical, the chemical, and the mental emotional stresses causing subluxation. By far in the New Jersey area, the mental emotional stress is really a big one. I find most people have a combination, and the largest percentage of that is coming from the mental emotional situation. Now, in chiropractic care, initial care is where we're trying to calm down the rage of this interference. We're trying to get it under control, and that's where we're getting symptom control. The next part, we have corrective care, and many times we'll be seeing a patient 3 times a week for a while to get the spine more in alignment, so that it takes that pressure off, so that the subluxation isn't going to be a reoccurring situation. Then we can do maintenance care with people elect, which is where we try and preserve that part that has been damaged. And the next part, which is my favorite part, is wellness care, where we're checking the person's spine to make sure everything's going well, but we're also checking lifestyle and making sure that the causes of subluxation are not rampant, and so we can address them if they are. So maybe we can get the person back exercising and doing all these different things, or whatever, or off the wrong foods, or rein in the stress levels, so that they can just maintain this great wellness. One thing that comes up all the time, and you know, a lot of times chiropractors don't want to address it directly, but I am going to right now, and that is, once you go to a chiropractor, you got to keep going. Well, that is true and not true. Okay, let's talk about the not true part. The not true part is that you don't have to go to the chiropractor all the time and maintain this. It's totally a choice. Let's talk about how we view the world. Are you a proactive person or are you a reactive person? Well, let's talk about dentistry or teeth. If you're a proactive person, you're brushing your teeth and you're flossing, you're taking good care of your oral health. And the reason you're doing that is because life is good, you want to have a great smile, and you just, things couldn't get any better and you want to keep it that way. Or you can be like, oh, I got to brush my teeth, and I just don't want my teeth to fall out, so I'm going to do it, but I don't really want to do it. The same thing is true in chiropractic. You can be coming in, and just like that person in the waiting room, you see these people coming in, and they look, there's never mind, not a thing wrong with it, they look like the picture of health. Well, you can come in proactively and saying, like, I want to be, at the top of my game, I perform really well, and I just want to stay there. And that's one of the things we do. If that's the case, yes, you're going to come in every so often. You're going to have repetitive visits. Now, the more reactive, the person with the more reactive view would say that, oh, I have this back pain, or I have this dysfunction in my stomach, fix it, and I'm out of here. I don't want to have this problem, so fix it up for me. And that's what we do, and we work for them. And these people don't come back all the time. They could if they wanted to, but that's how they view the world, and that's what we do for them. The majority of new patients come in to see me because they have some type of pain or dysfunction, but they wind up staying because they just felt so great, and then they realize, wow, I could actually stay really healthy and have this great life. So they wind up coming for multiple visits. Now let's go back to the new person in the waiting room. So they're trying to figure out, why are all this diversity there? The common denominator is that all the people with different conditions have the same problem going on, and that is interference in the nervous system. I mean, you could have the standard things such as, back pain, neck pain, headaches, athletic injuries, all that kind of stuff, being caused by nervous interference, but there are also things like ADD, allergies, asthma, bronchitis. These things are aggravated by nerve interference, actually caused by nerve interference. Problems with dizziness, irritable bowel symptoms, hiatal hernia, or GERD as they call it now. Little kids coming in with earaches, people coming in with blood pressure problems, menopausal issues are a big problem. People come in with insanity, not insanity, insomnia, mono, Lyme's, sinus problems, skin problems. All of these are amenable by fixing the nervous system. All the people with different conditions have the same problem going on, and that is interference in the nervous system. Now, only a chiropractor can tell you if you have subluxation going on in your nervous system, which needs to be adjusted, which is gently put back into place. Now, not all cases are chiropractic cases, but a chiropractor will tell you whether or not it is, and if it is not a chiropractic case, we will help refer you to the appropriate person. The other thing I want to tell you is that some cases resolve beautifully, 100%. Some resolve by percentage. And there are cases we work with other medical professionals in order to get you the best care possible. So once again, I'd like to go back to that new patient in the waiting room, and I want you to go away with the idea that that the body is a self-healing, self-regulating system, and the power that made your body from 2 cells into 50 trillion cells, the power that built you, the doctor within, will actually help you to heal yourself. I thank you.